All right, welcome back. This morning we continue our coverage of Men's Health Awareness Month. We've got Dr. Nathan Starke, who's the medical director of the Men's Health Clinic at Houston Methodist with us. Dr. Starke, good morning. Thanks for being here. How you doing?
Good morning, Owen. Thanks for having me.
Oh, I'm so glad you're here to talk about this. It's an ongoing conversation. One of the points we made yesterday was this idea that men tend to ignore their health in ways that maybe even women don't. You have this Men's Health Clinic. Why is it so important for us to have this kind of a month where we can just talk about guy stuff, I guess, in that sense?
I'm glad you asked. And I'd say the first reason is something you already alluded to, in that talking about men's health is something men are particularly terrible at. And so just having that conversation out in the open really, I think, is important for two reasons. To get men in for standard screenings and just staying on top of their health care from the beginning, as opposed to letting problems develop. So screenings of things, blood pressure, just making sure their health is good. But then also to raise awareness about specific men's health issues that affect a lot of guys' quality of life that they may not know can be fixed.
Right, right. And some of these will show themselves later in life, sometimes earlier in life. I mean, if we're putting this off, are we missing valuable time maybe in our 20s or 30s where we should be getting screenings or exams that maybe we're missing? And now here I am at 50 going, what did I miss?
Very, very true. And I know for me and almost everyone I know, in your 20s, for example, nobody goes to the doctor, everybody's healthy, don't need it yet. But right around your 30s, I'd say at latest 40, making sure you have a primary care doctor to go see, just to check on the usuals, is always helpful. And in our line of work, for example, with erectile dysfunction, we will often uncover heart disease as part of a workup for low testosterone or erection problems. So really what's most important is seeing a primary care doctor, and as far as urologic concerns, symptoms like urination changes, sexual function or difficulties, infertility, just changes in how you feel in a male-specific way are the issues that are sort of our bread and butter that we nearly always, with lifestyle changes, medicine, or surgery, can fix.
Well, obviously the whole body's interconnected, but when we think about men's health, we tend to think about this middle area.
Yeah,
I mean, it's probably more than that, no?
Oh, of course, very much so. And especially very hot buzzword these days, low testosterone, which has a whole lot of marketing and a whole bunch of, we'll say, less than scrupulous actors sort of promoting it. In fact, low testosterone is a very common problem and can affect not just the middle, as you said, but things like your energy, your mood, your sleep, your exercise ability, sort of fundamental things for vitality. And so it really is the whole man put together. So if a guy's getting up there, maybe we're in our 40s now, we're starting to feel these things, a little sluggish, maybe we're not feeling as strong as we used to. Are there things we need to look at first when we're going to talk to our doctor and say, hey, check the heart, check the eating, check the prostate? What's that priority list for us? Well, to be very honest, hopefully whatever physician you go see, or physician assistant, et cetera, knows those things. And there's pretty strict guidelines about, at this age you check this, at I think it's 45 or 50 you get a colonoscopy for colon cancer. But I'd say a general check, especially if we're saying 40 and beyond, of pretty much everything is always very useful, whether that be your heart and lungs, your endocrine system, your hormones, testosterone, even just electrolytes and blood count. The basics is really what you need initially. And then between you and your provider, you can sort of determine what things may be a bit askew and would merit further workup. Are there things that we get confused, symptoms we may say, oh, well, this feels like, I don't know, something, and it ends up being prostate? What do we do about sorting out that? So prostate issues, typically, the two big ones being enlargement, which causes urination difficulty, and prostate cancer, typically are men in their 50s or older. However, younger guys can have similar issues, certainly related to the prostate or somewhere in the urinary system. Asymptomatic, however, would be screening for prostate cancer. It would be very rare to have symptoms of prostate cancer until very late. And so part of the process is not only talking about urination difficulties or symptoms that come from your prostate, but also to look at the non-symptomatic things to make sure we're not missing something we could fix. I think that's one of the scariest things for guys. I mean, I'd heard recently that maybe the early stages of testicular cancer are painless, and these things where it's like, boy, that can be scary. So how do we address that with our doctor, some of these fears we might be having? I'd say communication is key, something I've figured out being applicable to all walks of life. Communicating your concerns exactly as they are, and it sounds a little childish almost, but to write everything down before you go is a really good way to hit the check boxes, make sure all your concerns and questions are answered. And oftentimes, because us men are so bad at going to the doctor on our own, in concert with your partner or whoever might be kicking you in the butt to go to the doctor a little bit, writing everything down to make sure everything gets answered is always a good way.
Yeah, sometimes it's just breaking the ice is tough.
Yep.
Just to say those words, maybe I'm having trouble urinating or whatever. It's a very personal
Very
thing,
much so.
right? It's tough to. So I guess that's why the relationship with the doctor is so important.
Yes.
And find somebody you trust.
Find somebody you trust, and that's what we value very highly at the Men's Health Center is while we don't treat, for example, high blood pressure or do all the standard primary care doctor checkups, lots of guys come into the office, haven't seen a doctor in 10 years, and so we will set them up with all the specialists and general practitioners they need. And I tend to think I'm kind of funny, so easy to break the ice with people and really gets them to be disarmed to talk about difficult stuff.
Right, and in that sense, it's not too late. I mean, as soon as someone's feeling the urge where we need to get some information, just go and do it. We don't want to wait.
100%.
Yeah. Dr. Nathan Starke, thanks for your time. Really appreciate it today.
Thanks a lot.
Very interesting.